Did you know that having large clots or flooding, which is gushes, during your period is not a normal experience? Good day, I'm Dr. Tia, and today we're talking about heavy periods. Having clots, large clots, and flooding, which is when you stand and there's a gush, signifies to me as your clinician that you might be having heavy periods. Now, some people start off and that's just the period that they start having. But there can be many reasons why patients have heavy periods. The most common being fibroids. Large, heavy periods like that increase the chance that someone will also become anemic. Because if you're losing too much blood, it might mean that with your next cycle, you haven't recovered from that blood loss, which means your iron stores are being spent unnecessarily and you end up becoming anemic because iron is an ingredient for blood. Now, unless you're trying to have a baby, you don't actually need to have a period. A period is a memo that says you didn't fall pregnant 2 weeks ago when you ovulated. So if you're having heavy periods, let alone those that make you miss out on life because you can't catch up with your friends and you can't do anything, given your period is very heavy or it is very painful, you don't probably need to be having a period unless you're trying to have a baby. There are many ways that we can reduce the amount of bleeding. We can do that episodically by giving you some tranexamic acid, which is a medication that reduces the blood volume given out by your blood vessels in your uterus, and Ponstan, which is an anti-inflammatory specific for the uterus. Those two skin the cat in different ways to minimize blood loss only at period time. You would take them from day 1 to 4, which are classically the heavier period days. For a more, shall I say, permanent or semi-permanent solution, having the pill, putting a menorrhagia in, are often ways that you can reduce blood loss significantly. And that's because up to 60% of patients who have a menorrhagia have no periods at all. So as a result, you're not losing iron, your life can continue, you can meet up with your friends, you have no period pain. These are all pros according to me. And so are important for you to think about if you're having heavy periods. The caveat's always, don't forget, I am not your doctor and you should liaise with a competent medical practitioner if that's what you are experiencing. Till next time.